So the following session is going to be very interesting for two reasons. It's because it's going to address really a very important issue. We're going to talk about women's cancer. The panelists will discuss about successes, challenges, but also most importantly, opportunities. What are the opportunities you have to address these cancers? So these type of cancers are very common, but as you know, it is also a specific type of cancer where we can really make an impact. In cancer, there are types of cancer that you can diagnose it and then you don't have much to do. But in women's cancer, especially cervical cancer and breast cancer, we know that we can make an impact. Yeah, so my name is Dr. Cyprian Shirambere. I will be the moderator of the session. I work for Partners in Health. I'm the director of oncology. For the past 10 years, I've been working with the Ministry of Health to design and implement different strategies to advance cancer care, including the support that we provide to the cancer center in Butalo. So today I am together with Dr. Fidel Ruwagumya, who is a clinical oncologist at Rwanda Military Hospital, and he's also a senior lecturer at the University of Rwanda. We also have Dr. Isabel Izimukwiye. He's a senior pathologist at Rwanda Military Hospital with a specialization in breast pathology. We also have Professor Alain Toledano, who is joining us online. Professor Alain Toledano is a radiation oncologist. He's also the president of the Raphael Institute, and he's also the president of the Association Franco-Africaine de Cancérologie. And he's also a coordinator of IRCAD Africa, and he's based in Paris. We also have Dr. Runyange Tarsis, who is a gynecologist at La Croix de Hospital, which is one of the leading private hospitals in Rwanda with a specialization in women's health. So, as you all know, women's cancer, especially breast and cervical cancer, are the leading cancer morbidity and mortality, and yet we know how to treat these cancers. The science is known, the technology is there. Even cervical cancer can even be eliminated. But every day, we continue to see women dying from these preventable and curable cancers. Rwanda has made a lot of progress to address the growing burden of these cancers. As we speak now, half of the facilities in Rwanda are equipped with the facilities to do cervical cancer screening and breast exam. We have 5 histopathology labs in the country with the capacity to diagnose cancer. We have 3 cancer centers which are able to provide chemotherapy. Access to surgery has improved significantly in Rwanda, and we have access to radiotherapy with the 2 linear accelerators machine, and a brachytherapy machine is on its way to come in the country. But the journey toward universal access is still long, but here we are. I want to start with Isabel. Since we are talking about women's cancer, and for the purpose of equity, I want to start with Isabel. Isabel, over the past few decades, we have made good progress in building capacity for cancer diagnosis. As an example, in the past 10 years or so, we only had 1 pathologist in Rwanda, and currently we count more than 15 also. So that is an example of the progress. But what do you think are the remaining gaps and what are the foreseeable opportunities to address these challenges in order to achieve equitable access to timely cancer diagnosis in Africa with the focus on women's cancer?
Thank you. As you said, I think even before genocide, even up to 2012, we only had one pathology laboratory in the south, in Seashibe, in Huye district. Since before the genocide against Tutsi up to 2011, end of 2011, I think the King Faisal Hospital also started doing histopathology, and 2012 Seashika and Butaro started. 2016 RIMH started. Currently, we have 5 laboratories in public hospitals, but we have also one in private sector, which started in 2017. So as you said, we started with one pathologist. He was even a foreign, and the program of pathology residents started in 2013. And in 2017, already 4 pathologists graduated from University of Rwanda. Currently, we are 21. But as you said, more progress have been done since then, but still we still have more challenges and gaps, especially in diagnosis of breast and cervical CA. As you know, in developed countries, we have subspecialties in breast pathology and gyne pathology, but currently we don't have here in Rwanda. So that is one. And our laboratory are mostly doing routine exam on